Yeah, my name is Dr. Bernardo. I'm a naturopath, and I treat people holistically, which means I treat the whole body. I use no prescription drugs, none of that. What happens, a patient comes to me with cancer, their doctor or oncologist does what he has to do, and normally the patient comes to me in the final stages of the disease, and many times we can turn them around very dramatically. One of the things that we found out that all cancer patients, their pH is acid, which by this I mean everything in nature has a pH from 1 to 14, 7 being water, blood being 7.2. When we're born, all our intercellular fluids, including saliva, have to have a pH of 7.2 to 7.4. When cancer patients come, or anybody's very sick, they're very acidic. Their pH runs around 5. So what I get the patient immediately, and I've been called a quack for saying this, put the patient on lemon juice and water. Lemon juice is an acid, and when you drink it, it helps to an alkaline tide in the body, so your pH starts going up. It might take 3 weeks to 4 weeks, because you're approximately 80% water. So if you weigh 200 pounds, there's about 160 pounds of water. We have to raise the pH to 7.2. And it's been my opinion that all cancer ceases at pH 6.8 and it dies at pH 7. I have many patients that came to me that were told, go home and die. You've got 4 weeks, 5 weeks. But I have many other people that come to me, they've been written off. And I've been arrested because I was treating patients in this country, and I'm not supposed to treat patients. I treated only patients that had been written off. They had chemotherapy, they had radiation, they had countless surgeries, and they never address the problem. You only have cancer because you have acidosis. That means your cellular fluids pH are in the neighborhood of 5, and that's why you have pain. Why do you have pain? Because vinegar is a pH of 5.3. If I inject vinegar, you have excruciating pain, and that's why you have pain, because you're very acidic. Cancer is on the rise. We spent trillions of dollars. You know, we're winning the war. Hell, we're not doing a damn thing, losing our ass. 1 out of 2 people, that's 50% of people have cancer right now. Okay, 50%. I had cancer. All my nurses are crying. I said, why are you girls crying? Well, you got cancer, you're going to die, and I'm going to lose my job. I said, if I can't get rid of my cancer, I deserve to die. A month later, my cancer was normal, as evidenced by my PSA, which had been 48, and then it was 0.0. It's been 0.1, something like that, in the last 5 years. And I tell patients when they come to me, well, my doctor says I got 2 weeks, or I got a month, or 2 months. I said, unless he gets a phone call from God, and God tells him, Mrs. Such and Such has only got 2 weeks or a month, then you can believe it. What the hell, he's just a man. He goes to the toilet like every other man. He's not God. He may think he's God. He's arrogant. Most of them are. I've been in medicine 51 years, and I can tell you 20% of the doctors are fantastic. The others, unfortunately, are in it for money. Look, they're talking about prostate cancer. Well, we got to freeze it. We got to do this. It needs some nutrients. I've never had anybody that died of prostate cancer. I've had Scripps La Jolla. Dr. LaChan sent me a patient 6, 7 years ago. His PSA was 4,280. Anything over 4 is cancer. Normally at around 1,200 you die. This was a mean old crabby guy, and I should have let him die. But anyway, Dr. LaChan said, can you help him? I said, well, how much time you give me? He said, a week. I said, oh, hell, that's plenty of time. He said, Bernardo, get serious. His PSA is 4,280. I said, well, hell, that's no big deal. He said, get serious. You understand English? I said, I'm an American, dummy. 4,280. I said, send him to me. He said, he also got bone cancer. I said, of course, it comes with the territory. I said, what's his alkaline phosphatase? He said, it's over 2,000. I said, no big deal. He said, Bernardo, are you for real? Are you a madman? I said, call me what you want, send me the guy. When the guy came, he could barely walk. He walked like a 100-year-old guy. Pain, we had to put like 5 pillows on him because of the pain. A week later, his prostate-specific antigen called PSA, which is a marker that identifies the cancer in the prostate, had dropped by 1,000 points. In 5 weeks, his PSA was 0 point something. 5 weeks. Dr. LaChance told me, he says, I find it hard to believe that you can do this, and over here we can't do those things. His pH when he came was like 4.8. At 4.5, you die. Slowly, within 3 weeks, his pH was 7.2. And in 5 weeks, he's completely free of cancer.